The speaker for our next talk is Kit Rodolfa, and he will be representing Raid Ghani from Carnegie Mellon University. The project that Raid and Kit are leading is focused on improving fairness and equity in applying machine learning and policy to COVID-19. So I will turn the floor over to you, Kit, and thanks very much for speaking today.
Great, yeah, thank you, and thanks for the opportunity to come and speak. Very excited about this work and everything that everyone's doing here. So yes, I'm Kit Rodolfa. I work with Raid Ghani at Carnegie Mellon, where our group spans the machine learning department and the Heinz College of Public Policy. And so we're thinking a lot right now about fairness and equity and policy applications of machine learning, particularly around the impact of COVID-19. And so our research here has three kind of high-level aims. The first is really to understand the uses of data and machine learning in the pandemic response and what the implications of those use cases are for fairness. Second is to think about the appropriate conceptualizations of algorithmic fairness and equity in these different settings. And we're doing a lot of this work really through kind of hands-on case studies and particular projects. And I'll talk more about that and kind of the very non-obvious problem of figuring out what fairness means in a given policy context. And then third is, what do we do about it? How do we improve fairness of machine learning models in these sorts of settings? And how do we develop good open source tools that the community at large can use as they're working on their projects and trying to think about and improve fairness in their work? So just to kind of go through some of these quickly, and I'll actually spend the most time on that last point of improving fairness. But our first bit is really kind of starting as a policy analysis and thinking about what are the key policy decisions that are happening in response to the pandemic, and what are the data and tools that people are using right now to inform them, what data and tools maybe could or should they be using, and kind of developing really a very big picture kind of inventory and resource that we hope will be useful both for policymakers and hopefully in the course of this pandemic and kind of forward looking for the future, as well as of course for researchers both on the kind of data science machine learning side as well as the policy side. And here we're thinking about these decisions and applications not just kind of focused on the public health response, but also in the scope of economic policy, social services, and supporting homelessness and food insecurity, criminal justice, especially around kind of jail releases and changes in kind of court and police policies, as well as education. So then kind of drilling down further, we need to think about what fairness means in these policy applications and how to kind of conceptualize it. And I think a lot of work has happened over the last several years in the algorithmic fairness world that really kind of highlights the fact that there are many, many different ways that you could conceptualize and measure fairness. It's not a sort of well-identified kind of statistical concept in and of its own right. You could think about the representativeness of individuals that are chosen by a model for some intervention. You could think about the types of mistakes that a model is making, false positives and false negatives in different ways, and the potential harms of those. And one of the really key and important results out of a lot of this work to date has been the fact that many of these definitions are inherently kind of mathematically incompatible, at least up to perfect prediction. And so you have this tension of, well, if we think about fairness in this way, we're sort of guaranteed to be unfair, by some other conceptualization. And so how you think about fairness in a given context is really kind of comes down to a policy problem and thinking about the stakeholder and societal values that are at play and coming to some conceptualization of a metric or maybe several metrics from different perspectives and viewpoints, and understanding what fairness means in a kind of setting by setting sort of way. And the way that, because this, then becomes very context dependent, the way we're thinking about, learning and understanding this is really through the lens of several case studies. And so I'll mention, several of the ones that we're working on here. And the first is really thinking about kind of how social service recommendations are sort of allocated and targeted from the context of a partnership with Code for America, which runs the Get Cal Fresh, which is the SNAP application in California for food stamps. And there they saw a massive influx of new applicants as the pandemic really started to take effect, particularly early on. I think about a 500% increase in applicants. But many of these people coming in have other needs that they're struggling with, and so they want to be able to help direct those people to other services that may be useful in meeting those needs. And so we're looking at one, how they can do that efficiently, and two, how they can do that in an equitable manner. The second kind of relates to thinking about modeling around the epidemic and in partnership with COVID-Cast out of Carnegie Mellon as well. A third looking at mobility data, such as SafeGraph and a fourth that I'll spend a little bit more time today on is thinking about targeting mental health interventions to help break the cycle of incarceration. This is a partnership with Johnson County that actually predates the pandemic, so it's a little bit more well developed, but has become even more urgent given the nature of the kind of viral spread in the jail settings, and so trying to think about fairness and equity in that context as well. And so the third major goal here is thinking about how we improve fairness in these policy applications. And that really kind of gives us two major research questions. How well can we improve fairness of our machine learning models? And to what extent is there a tension between fairness and accuracy? And do we have to trade off kind of efficiency of the program for better fairness? So we're looking at this in all these policy contexts, and I'm going to focus on that last one I mentioned, mainly because the work's a little bit more well developed there. And so here we're kind of actually talking about this cycle of incarceration that a lot of social science work sort of leads us to see between people with unmet needs. Maybe that's homelessness, joblessness, mental health needs, substance abuse problems, that in some way leads to an arrest and landing them in jail. And the jail setting, of course, is not a great setting to help serve some of those needs, and in many cases can make them worse, leading to some reinforcement of this cycle. And so the idea with this project is to work with the Johnson County Mental Health Center to do outreach with mental health resources to people who might be trapped in this cycle, and hopefully break it and prevent future arrests and incarceration. So that's the broad setup. This program, of course, has goals around the efficiency of allocating these resources. They only have so much staff and budget for the program, as well as around kind of equity and fairness. And so as we've thought about this challenge of understanding fairness in different contexts and policy settings, we've tried to develop some tools that we think are helpful in kind of guiding that discussion. So this is something called the fairness tree, which we don't mean as truly prescriptive, but more kind of helping start the conversation and navigate the often kind of tricky landscape of the many different ways that you could think about fairness. And so this asks questions like, is your intervention, more punitive or assistive that you're trying to target. If it's punitive, so you could think here of things like health and safety inspections that might lead to fines. The kind of canonical example in a lot of the algorithmic fairness literature is more around bail determinations and denials. So you might harm individuals, especially through errors of inclusion or false positives, and focus on metrics around that. Or if it's more assistive and helping allocate kind of positive benefits and resources to individuals, you might harm individuals through errors of exclusion and false negatives, and so may want to focus more on those sorts of metrics. There's kind of a particular special case here, and this actually applies in the particular case study that we're looking at, where your resources are constrained and very limited, and so you can only help a small fraction of people where it might be appropriate or with need. And that leads us actually to focus on what we call recall parity. Recall in machine learning land, maps to true positive rate or sensitivity in kind of different languages of speaking about these things. And here reflects as well 1 minus the false negative rate. We find it actually pretty useful as a reflection effectively of false negatives, but with some properties where it's a little bit more kind of friendly. So if you're only helping a small fraction of the population, your false negative rates are naturally going to be, maybe they'll be 0.94 or 0.95. So ratios between them might look, kind of deceptively fair, where if you focus on recall because you're only helping the small fraction, you might see that, oh, there's actually big gaps in what fraction of the population of different protected groups you're actually providing assistance to. This is also termed in some of the fairness literature kind of equality of opportunity for that reason. Do people in different groups have equal opportunity to receive benefit? Just to kind of summarize the machine learning task that we're looking at here, it's kind of a classification problem where we're looking at the risk of reincarceration in the next year to target mental health resources. However, it's very resource constrained. They're only able to intervene with 500 individuals in a 6-month period. So we're focusing on an efficiency optimization metric of precision at 500 at the top 500. Rather than something like AUC or F1 that's kind of common in a lot of the machine learning literature. And for fairness, as I just mentioned, we're looking at this disparities across race and recall. And in particular with this work, we're looking at post hoc model adjustments, and we're to improve model fairness, so kind of treating the underlying model as a black box. So we're separately looking at some in-processing methods like regularization. So just kind of as an initial result, here we looked at running a large grid of different models, different logistic regression, random forests, boosting methods with different sets of hyperparameters, and then asked what is on a holdout evaluation set, what is the efficiency metric, precision at 500 on the x-axis, and the equity metric, which is this recall disparity here between white and non-white individuals on the y-axis of that top 500. And each pair of dots is sort of a before and after of making these adjustments for equity in a post hoc way. So the blue dots are the kind of before or without adjustment, so just focus on optimizing for efficiency. And the orange dots here are that same model, or rather the same model specification, but optimized or adjusted to improve equity. And so we can see that in all cases, if we had just treated this as a model selection problem, we wouldn't achieve very good equity even at much lower values of precision, but we can kind of correct for that problem and across many different model specifications. And one of the big take homes, or the initial result here, was, and there doesn't seem to be much loss in efficiency in doing so. In fact, it's kind of some even moving up and down just a point or two really seeming to be more dominated by the noise between moving from the training set to the validation set. So the next step of this was to think about, well, how do we kind of implement this in our machine learning modeling pipeline, and how robust is it over kind of time and different groups? And so there we looked at 3 different model selection strategies. The first, of course, is just kind of the standard machine learning, focusing on accuracy, efficiency, without accounting for fairness, so call that efficiency focus. The second is this sort of fairness aware approach, where we do those adjustments and then choose a single model after doing this adjustment based on its efficiency across all the groups of interest. And the third that we looked at was an additional option proposed by, I think, Bork and her colleagues, where you actually say, well, let's do model selection for each protected group that we care about. So each race or ethnicity group here separately, and then choose thresholds across those groups that optimize our equity metrics. So that the hope there being that maybe you'll improve your accuracy by choosing models that are best for each group separately. So we looked at those 3 strategies for choosing a model across many different validation sets here, split over time at 6-month intervals. And what we found was very consistent with that kind of initial look, that the precision, so the kind of accuracy metric for our models was very, very similar across these many different validation sets and across these different strategies. So whether even when we were making adjustments for equity, we weren't seeing a real trade-off in terms of precision. However, we really were doing something to make the models more fair. So the blue line here is the disparity, in this case, specifically between white and Black individuals, for the model strategy that just focuses on efficiency, where the orange and green lines are those 2 other strategies focusing on selecting an efficient model, but then adjusting for equity. And so we're able to very much improve the equity of these models across many different validation sets, but without a big trade-off in efficiency. Looking at white versus Hispanic equity, the story is a little bit more mixed, at least much more noisy, particularly with this composite model strategy. But over time on average shows good improvement as well. And here I think one of the things that we're kind of hypothesizing is that the Hispanic group is about, I think, 10% of the overall population here. And so there's a much smaller, they're a much smaller group of the population, and the model selection seems to be more subject to noise, in particular the composite strategy where we're selecting a model just on that 10% of the population feels like it's maybe more subject to overfitting and leads to some trouble with being able to as consistently or reliably improve the equity of those models. And so we did a resampling experiment to investigate the extent to which that might be the case. Here, looking at the error bars are taken over those many different validation sets, and we're looking at resampling from as low as 5% Hispanic population to up to 40%. And we can see, particularly for this composite model strategy, that it's very sensitive to the size of the population. But even for the single model that's chosen across all the groups, we see that the error bar is a bit larger as the group gets smaller, and so there's much more variance in your ability to, at least in a given validation set at a given point in time, to improve the fairness. I think I'm got just a couple minutes left, so I'll just give some kind of concluding thoughts. So we've observed not much trade-off in these contexts, which we feel like is a pretty surprising result, and we've seen this in some other policy contexts that we've been working in as well. I mean, it seems like the resource constraint setting is playing a real role here. We can only choose 500 people to intervene with in a 6-month period, but there are many more people who could be helped by the program. And so this, the fact that there are many ways to choose a set of 500 people that may be equally kind of efficient allocation of those resources, but some may be more equitable than others, is probably playing a role in kind of limiting that trade-off. And although that's kind of a specialized setting, it's a very common setting in policy context generally, and especially in the pandemic responses as well, not just in thinking about kind of the jail population and the impact of the pandemic there, but allocating relief funds generally, distributing tests, vaccines, masks, PPE, many of these things, we've seen very strong resource constraints relative to need, and needing to think about fairness and equity very much in those questions as well. So I think that's most of what I've got. We of course have a lot of ongoing work around these questions, different ways to conceptualize fairness in these different settings, as well as building and refining some of our open source tools to help integrate this for other researchers and of course practitioners to use, as well as looking at other kind of fairness enhancing methods. So I think that's it for me.
Great. Thanks very much, Kit. Really interesting research and great talk.